one of the issues that seems to have been coming up a lot in the conference is about weight gain. Laura, what do we know now that we didn't actually know before?
Oh, to be honest, not a lot more. So very brief background for people who don't know. Over the last 2 years, there's been a lot of focus on how HIV drugs might accelerate weight gain. Now, the reality is, on average, we all gain weight over time. Here in the UK, that's about 1/3 of a kilogram a year. In the US, not surprisingly, it's a bit more. And the two main types of drugs that have been implicated are TAF, which is the sort of new version of tenofovir that's been around for a few years, and also some of the integrase inhibitors. That's a group of drugs that's really the preferred choice in most guidelines now. And the newest drugs from that group, bictegravir and dolutegravir, which are very widely prescribed, have been shown to cause more weight gain. So when we say weight gain, what we're looking at is people in first-line trials, when they have not been on treatment before, gaining between 3 and 4 kilograms over 2 years. What we've learned at this conference is that that weight might settle down and plateau or flatten out, or it might not. There's 2 studies that really showed that. One was a study presented by Paddy Mallon, one of my colleagues, and he showed that in people switching old tenofovir to new, they gained quite a lot of weight in the first 9 months and then it settled down, but there's quite a clear step up. Then there was a study called ADVANCE, which has been discussed a lot, and unlike many of the studies we see in HIV treatment, ADVANCE was done 60% of the population were women, and often these trials are mainly men, and almost every participant was black, and many of the trials we see are in mainly white individuals. What that showed was much more weight gain, but quite concerningly, although it wasn't the complete set of data, they showed that weight gain continues between year 2 and 3. So just to put it in context, on one of the combinations most associated with weight gain in women, they've gained 8 kilos after 2 years on the treatment, and then another 4 kilos between year 2 and 3. So that's what we've learned really, is that there is a clear step up, new tenofovir, these integrase drugs, but it may not level out in all people.
Right. Oh, okay. And Linda-Gail, what are you seeing with weight gain in your region?
So Laura's already mentioned there these 2 kinds of tenofovir, the old one and then the new kind called TAF. So we don't yet have access to TAF. So our single regimen drug pill is made up of tenofovir, the lamivudine and dolutegravir. And there is a theory that the old tenofovir may, to a certain extent, have a kind of leveling out of the effect of the dolutegravir. So that may be a saving grace for us. That said, we are seeing weight gain. Not all of, I represent South Africa, not all of us have changed to dolutegravir. We were poised to make the move, and then COVID hit. And so that's delayed our move a little bit because we had to give people multi-month dispensation. And so it's held things back. So we, I think it's a space we have to watch. We are a heavy nation to begin with, particularly the women of our nation are on the heavy side. But interesting, and I think this is the important thing, is what does that weight mean? Because when we ask these young women, many of whom have gained some weight, they actually are not complaining. So, if for different folk, it may mean different things. And I think we have to see what the metabolic impacts are. There was one other important study came out of ADVANCE that said pregnant women who gain weight may have less favorable outcomes for their pregnancy. So we have to bear that in mind as well.
Right. Okay. Thank you. And Lucy, women do seem to be most badly affected by weight gain, but represent only a small amount of participants in clinical trials. What do you think we need to do to address that?
I just heard Linda mentioning DTG, and one of the reasons why we're being told DTG we are being denied DTG was because one of the issues would be to gain weight. As you can see, I don't know if you look at my photos outside here, you can see I'm big. I'm not a small young woman. I'm big-bodied, and I don't know if I have gained weight since I was put on DTG a year ago. I don't know, but I don't think it should be one consideration to deny someone a certain drug. And that said, we really just have to use common sense. We can't be saying we don't have women in trials and not doing something about it. We know we need to have women in trials. That is just common sense.